For people out there that haven't come across your work, can you tell us a bit about yourself and where you come from, what you do?
Well, like yourself, I live in Australia. Thank you. So yeah, I'm a sports and exercise medicine physician. So my background in terms of medicine, I started sort of, conventionally medical practice, and then very early on in the piece, I actually discovered low carbohydrate diets, and I discovered the science in an editorial in the British Medical Journal. And at the time, I was suffering metabolic syndrome, which, as you know, is defined by 5 features. And, in particular, I had incredibly high blood pressure, and I had very high triglycerides, and my HDL level wasn't up to speed. And you only need 3 of the 5 criteria. I wasn't obese. I didn't have abdominal adiposity. And as far as I know, I didn't have elevated fasting glucose, but I never tested that. But I certainly met the diagnostic criteria for having metabolic syndrome. And when I came across this editorial, I thought, good grief, this can't be true. I mean, this totally contradicts everything that I learned in medical school. And I learned it in medical school, so it must be true. But the problem was, it was actually authored by 2 doctors and scientists whom I respect greatly. So Professor Timothy Noakes and Professor Peter Bruckner. And I consider both of them friends now, which is, I'm incredibly grateful for that. But I sort of said, well, these guys aren't loonies. They're sort of doyens of sports medicine. And, within our field, we understand it's not coming from a very good evidence base. So these guys have actually introduced a modicum of science to the whole process. So I went and had a look at the references, and I thought, oh, there might be something there. So I sort of embarked upon a personal journey with, quite frankly, fantastic results. And over time, and I think, like with many people, and this is over more than 10 years, that initial low carbohydrate diet has morphed into various versions of ketogenic diets, Paleolithic diets, and then tending towards, basically a largely plant-free diet, tending towards carnivore diet. So it's been an interesting journey, and I'm always excited when I can chat with like-minded folk.
Yeah, well, me too. I mean, that was the thing too. So when did you sort of get to the point where you just stopped eating all plants altogether and you've just been really doing carnivore?
Well, I mean, honestly, I can't remember, but probably for at least 4 years, 5 years, I've had very little vegetable matter. And it wasn't a conscious decision. It was almost hedonistic desires. When I say that, it's like I only wanted to eat things that I enjoyed eating, and 2, that didn't make me feel bad afterwards. And as it turned out, I realized that, when I would consume lots of cauli rice and all of these low-carb staples, it didn't agree with me. It didn't sit well. At least it didn't agree with my gastrointestinal tract. So I sort of ended up steering away from that. And, every so often my wife would make a comment about, oh, you haven't eaten any veggies. And it's like, oh, yeah, I know. Thanks for putting it out. And even back then, I didn't really have any concerns about nutrient deficiencies because I knew enough about nutrition. I'd done enough reading to know that all the essential nutrients that we actually needed were able to be provided by my diet at the time. So in essence, I sort of stumbled on carnivore through hedonism.
Yeah, that's good. And well, that's good. And then so you've done a number of talks at various low carb conferences, medical conferences that sort of specialize in this sort of alternate view thinking, like Professor Noakes and Steve Phinney and things like that. They've all sort of they very, very hard science-based, evidence-based conclusions, but sort of to the tangential to traditional medicine. So some of the things, what are some of the things that you've discovered since you've sort of had this awakening that, everything you learned in medical school wasn't quite picture perfect? What are some of the things that you've come through that have been, probably quite controversial, but you think, really, really stand up?
Well, I mean, if we try to, the list is too long. So number 1, saturated fat won't kill you. Saturated fat doesn't increase LDL. LDL, for all intents and purposes, if it's undamaged, isn't inherently harmful. If you restrict salt intake the way the government or the advisory panels advise us to, then you could actually increase your chance of dying. Fiber is not an essential nutrient. In actual fact, it's an anti-nutrient. It's the opposite of a nutrient. The fact that it's not digested by definition means consuming fiber is akin to a malabsorption, maldigestion disorder. It just goes on and on. Seed oils, which have been promoted, polyunsaturated oils that have been promoted are healthy, are not necessarily so. It's not the fact that the seed oils are bad, the omega-6s are bad, but there's certain chemicals and constituents and oxidative properties within seed oils that are bad. So there's just a couple of, I guess, the foundation pillars of the food pyramid. So if you said, well, what's wrong with what we get taught about nutrition? It's just the foundations.
Yeah. It's just
all
everything.
Of them.
Yeah. So, speaking about seed oils, that's something that certainly the proponents of seed oils try to say, oh, it's not that bad. It's not that big a deal. I know that you're going to have a debate with Lane Norton in, I think, February, you said. And
that's the plan.
Yeah. And so, and he's someone that from what I understand, doesn't think that seed oils are that big of a deal, that actually aren't a problem. So what are your thoughts on seed oils? Just sort of flesh those out a bit.
Well, the interesting thing about seed oils is that we've got research data that demonstrates their harm. But I guess the problem has been we've had limited mechanistic understandings, or at least a widespread knowledge of the mechanistic understandings of their harm have not been well known. So it comes down to a couple of key things. So first of all, there's a common view within the low carb sphere that omega-6 fats are inherently inflammatory. And because seed oils have abundant omega-6 fats, that's why they're harmful. And this has been borne out of associational research where we have a look at the ratio of omega-6 and omega-3 fats within people's red blood cells and other tissues of their body. And we find that people with more omega-6 fats in their red blood cells do far worse on multiple parameters, multiple autoimmune diseases, allergic diseases, so on and so forth, cardiovascular disease, inflammatory diseases, you name it. It's having a high level of omega-6 fats in your cells is associated with adverse outcomes. But this is only associational. And I personally do not believe that it's an inherent property of omega-6 fats that is harmful. And I don't believe that's what's making seed oils harmful. So the fact remains that omega-6 fats are essential oils. Without them, we're not doing so good. That's the very definition of essential. So there's two key properties of seed oils that makes them harmful. So the first one is its tendency to oxidize. So the tendency to oxidize, it's akin to the chemical process of rusting. It's what happens when you have free radicals that rip electrons away from other molecules or atoms and they damage them. And if you do that to a fat or a protein within the body, that's going to have deleterious outcomes. And we know that seed oils, by virtue of their chemical structure, these polyunsaturated bonds, where these double bonds between two adjacent carbon atoms, that is very, very reactive. We've also demonstrated that when you consume an oxidized oil, that gets incorporated into the lipoproteins of your body. Things like chylomicrons, or what most people would have heard of, low density lipoprotein, what is called bad cholesterol, LDL. And then you've got circulating oxidation products. So think about it, if you've got an unhealthy diet, your LDL basically becomes a vehicle to carry oxidation around your circulation. So that's the connection between oxidation and damage of your blood vessels, and LDL is basically the vehicle for that. So that's obviously not going to be a good thing. So oxidation is a component of seed oils which is, harmful. But one thing that is not well understood, and that's something which I'm going to hope to promote a little bit more over the coming months, is something which I term fake plant cholesterol. You would have heard of plant sterols or phytosterol. Mm-hmm. And these chemicals, I think we can mount a very strong argument they are absolutely deleterious to the human body. And they are in high concentration in seed oils and vegetable oils. They're in basically every plant food. So we get a not insignificant contribution to our phytosterol or fake plant cholesterol load from cereals by virtue of how much we eat. but on a gram for gram basis, seed oils provide us with the most. Now, the thing is, this imitates cholesterol, and in some cases, the body can absorb it. But when it absorbs it, the body tries to do things with it that it would normally do, that it would normally use cholesterol for, but because of some molecular variation, very subtle molecular variation, it can't do it. So it basically leads to deficient functions of things that cholesterol is normally used for. Now, the irony is that we use these plant sterols to try and lower our body's lipoprotein levels, because as you know, lipoproteins contain cholesterol, and if you can create defective cholesterol within the body, then it's going to have trouble synthesizing low-density lipoprotein, or synthesizing VLDL, very low-density lipoprotein, which shrinks down into low-density lipoprotein. So that's how our cholesterol levels, or what we call our cholesterol levels, our lipoprotein levels, are actually lowered with plant sterols. So we often use this therapeutically to lower people's cholesterol. Mm. But here's a question for you. If this is such a good thing, what would happen to somebody who would absorb an unusually large amount of these plant sterols? They must have very good cardiovascular health, because it would lower their cholesterol and it would be very good for them. That, if we follow this theory through to the logical conclusion, that's where we should be. If plant sterols are good because they lower your LDL, people who absorb more plant sterols would do better. And this is in the context of the fact that most of us will only absorb about 1% of the plant sterols we consume, because our body is doing its damnedest to try not to absorb them. It's kicking them out. But if you consume a bucket load in seed oils, in a standard Western diet, then some is going to get through. So we only absorb about 1%, but some people absorb a lot more. They've got a genetic change in their DNA that leads to just excess absorption of plant sterols. That condition is called cytosterolemia, SITOSTEROLAEMIA. You can drop out the A if you don't speak the Queen's English. Now, we can talk about the spelling thing between different countries later. But cytosterolemia is a condition, and I quote, that is associated with advanced, severe, premature atherosclerosis. Huh. Yeah. So these plant sterols, which we're giving people to prevent heart disease, if you just happen to absorb more of them than is normal, then you're probably going to die of a heart attack. Well, that's a bit odd. So, I mean, these are the kind of things that we should be looking at. We should be understanding biology. Everybody wants to throw up, oh, I've done this epidemiological study and I've done that epidemiological study, and they don't really have any basis for understanding root cause mechanisms. So basically, a lot of what they say is biologically implausible. Let's go on to, for biologically implausibility, the next time, somebody says, oh, you shouldn't eat saturated fat. Play a little game. Okay, so why shouldn't we eat saturated fat? Because it will raise your LDL, and LDL is bad for you. Okay, great. How does it raise my LDL? And they won't have an answer. There is no known plausible biological mechanism, either demonstrated experimentally or even postulated, by which saturated fat increases LDL levels, low density lipoprotein levels. And that's going to shock a lot of people. And in actual fact, what it is that on a standard Western diet where you're consuming vegetable oils, the plant sterols are lowering, they're artificially lowering, they're taking your LDL level from a healthy, normal, physiological level, and they're lowering it. And all that happens, if you remove the seed oils from the diet, you allow your LDL level to return to a normal physiological level. So let's talk about evidence for this. So we're making bold claims, we need science. How about a study from British Medical Journal that looked at what happened when they supplemented people with different fats, and they had a look at the impact on their LDL levels. So they used a coconut oil that was 96% saturated fat from memory. And the standard is about 92, but in this study, I believe from memory, it was 96% saturated fat. And they compared it with butter, which was only 66% saturated fat. So the people who consumed the butter, their LDL level went up moderate amount. What do you think happened to the people who consumed the coconut oil? 96% saturated fat. given that, you know, we know that saturated fat increases LDL. Yeah. Well, their LDL levels actually went down. Now, the interesting thing was there wasn't really much discussion about this in the paper. I actually had to go to one of the appendices to actually get the data. And when I saw it, I said, well, I can see why they're keeping quiet about that, because I'm sure that's not the point they're wanting to make. But I mean, if they were genuine scientists, that would have been the headline of the paper. You know, saturated fat does not, you know, 96% saturated fat in coconut oil lowers LDL. I mean, that's an important empirical observation that informs our understanding of science. And instead, it's left to people like you and me to trawl through the papers and have a look at the appendices and the supplementary data to actually find where there's been a bit of mischievous reporting.
Yeah, and that's the thing too, like because that is so pervasive in our understanding as medicine, as medical practitioners, and just lay people. But it's one of those examples of something that just gets repeated and repeated and repeated, and people have heard it so many times. It's just taught in medical school, but nobody asks, where does that come from? What's the origin of it? You know? Well,
I mean, the interesting thing was that I came across that when the genesis of my lecture on fiber came about. I was writing a chapter for a medical textbook on nutrition. And as you know, when you're writing an academic text, everything needs to be referenced to the nth degree. And I was low carb at this stage, but I hadn't ever looked into the science of fiber. So I got to fiber and said, you know, recommendations. Yes, 30 grams of fiber a day is recommended for adults. Here's the reference. I looked at it and said, well, that's an advisory statement. You know what I think about advisory statements? Not much. Yeah. It's like, well, let me go to the advisory statement and I'll see where their references were. And I followed the chain back, and it would always stop. You could see an opinion, but nowhere was the evidence actually cited. And I'm like, well, this is odd. I mean, I'm looking at research on fiber, and there's a few things that are absolutely well known. So yes, it does increase the bulk of your feces. If you ingest something that the body can't absorb at all, then it's going to have to come out the other end. So your feces is going to be larger. That's obvious. It's an irritant, and it can increase transit time. So things can travel through your intestines quicker. Yes, that is true. But when we actually looked at it in terms of symptoms of constipation, so as a doctor, you don't have somebody come to you and say, oh, doc, just over the last few months, my poops have been quite small. There's no pain or bloating, but they're just a bit small. Do you think you could just make them a bit bigger? or you don't have anybody saying, you know, look, I did a test, and it's taking 2.5 days for my contents to transit all the way through the gastrointestinal tract. Do you think you could speed that up 12 or 24 hours? I mean, people aren't aware of this. They have no symptoms. People care about pain. They care about bloating. They compare, you know, they complain about bleeding. These kind of things are actual genuine symptoms that adversely impact on people's lives. And when I went looking at the literature for evidence that fiber could benefit these things, the diagnostic symptoms of basically constipation we use in the clinic, the data was absent. And instead, I found a beautiful experimental trial where they actually put people on different levels of fiber in their diets. They had subjects who all had idiopathic constipation. So idiopathic, if you're not medically trained, so idio means idiot and pathic means pathetic. So it's just the diagnostic label a doctor gives to something when we don't understand it. So it's more a reflection on the doctor who'll give the diagnosis, because it's basically idiopathic means I don't understand it and I really have no intention of trying to find out. But anyway, so these people had constipation, idiopathic constipation, and they were all on, you know, moderately high fiber diets. So then a bunch of them were placed on even higher fiber diets, and across 5 domains, their symptoms all got worse. Then some of them were put on low fiber diets, and their symptoms across the board generally improved. And then a group of them, the largest cohort, were placed on 0 fiber diets. And in every case, all symptoms of constipation were completely eliminated. And to date, in terms of looking at symptoms of constipation, not fecal transit rate or mass or any of these, surrogate markers, which don't mean anything to the real patient, not the patients that I'm seeing, but the real things like pain and bloating, a zero fiber diet was hugely, hugely successful. So this was a case where I'm sort of writing a textbook chapter and I'm sort of thinking, wow, my understanding is completely been thrown on its end. So I had a choice. I could either ignore the science and just, not open myself to any criticism and write it as I was writing it, or I could say, well, no, I've just got to call it the way I see it. I've got to be, it's an academic textbook. I have to be a bit scientific. Let's open myself up to some, potentially up in some criticism, but that's unfortunate. That's what the public expects us to do.
Mm-hmm. Yeah. And that's the thing too, is that, when we're in, in the medicine, I'm sure you come across this, on different, surgical rotations or, or just come across it in the hospitals. When someone has like diverticulitis or bowel anastomosis or conservatively treated appendicitis, what was the first thing they do? They put them on a low residue diet. They put them on a low to no fiber diet because this has to rest the bowel. Well, why is that? I mean, wouldn't that mean that there's inherent harm being caused by the fiber? If fiber was good for you, if this gave benefit to your colon, wouldn't that be exactly what you want in times of stress like that?
Yeah, I know you and I have talked about this before. I actually did 2 colorectal surgery rotations as a junior doctor. Now, the choice was because I don't like doing night shift. Yeah. So I'd rather do colorectal surgery than stay awake all night. I'm just that kind of guy. But the patients there actually taught me a lot. And the interesting thing was looking at colostomy bags. And the patients are smarter than the doctors because they figured out that if they just had low residue foods, meats and things like that, that don't contain any fiber, then their bag, when it came to getting changed, it might have a little bit of fluid in it, but it had very, very little fecal matter because everything they were eating was able to be digested and assimilated into their body. Whereas the fiber, and these, if they had a lot of vegetable matter, fruits and vegetables, then their bag would be overflowing. And this really speaks to the lie where you have these activists who say, oh, don't eat meat, it will putrefy in your stomach. And the exact opposite is true. So putrefaction, basically rotting under the action of bacteria, that's what fiber does. That's what foods that are non-maldigested do. If you're consuming something like meat and you've got a hyperacidic stomach that can help break it down and you absorb it all, then there's going to be very, very little residue that will come out of your gastrointestinal tract. And a lot of people, when they go to a meat-heavy diet, report to me, I've just got incredibly little amount of fecal matter, a very little fecal bulk. And, so it actually was much nicer for the patients with the colostomy bag. So a colostomy bag is basically where you've had bowel surgery and you redirect the intestine coming out through the abdominal wall. And so people on a low residue diet, they had much more pleasant experience changing their colostomy bags.
Yeah. And that was something I saw as well. There was this study a while ago. They were looking at protein absorption from different sources, so plant sources and animal sources. And they found that, like, by studying people with colostomies, they feed them different things and they just study the contents of the colostomy bag. Very little of the animal-based protein was actually getting into the colostomy bag, or quite a large proportion of the plant proteins getting in there as well.
And that, I have seen that study, and it's interesting that when you tweet something like that out, you get a lot of haters.
Yeah, of course you do. Yeah, because we're supposed to be eating plants. We're herbivores. Didn't you know? We have flat teeth like a cow. Yeah.
Well, the whole interesting thing is I read a paper that was promoting insect protein recently. So all pathogens and these things aside, which is going to be a huge problem to overcome, they were actually comparing insect protein favorably, saying it's just as well absorbed as plant proteins.
Oh, just it. Wow.
And it was fantastic. I'm saying, well, if you set the bar low enough, anything looks good, right?
Yeah. I mean, it's just as absorbable as asphalt, if not more so, it's even better than this horrible thing that doesn't work well. That's funny. It was actually funny once I saw years ago, There was a study that China did, just subjected their college students to, because you can in a totalitarian dictatorship, and they just put these college students on just crickets. And they're like, yeah, you're just going to eat these like crickets or grasshoppers. That's all you're going to eat. And they made them just eat these things, and they just wanted to see what happened. They were convinced this was going to make them actually very sick, and they thought, oh, this would be fun. Let's watch a lot of people die. And in fact, they found the opposite. They found that people actually getting much more healthy, and their academic scores were going up. Their body habitus was improving. Basically, they were putting them on a carnivore diet, but just the bug version of it. And this was actually so much better than just like the traditional sort of diet that these people's health were improving. But it was funny though, because you could tell by reading it that they were actually hoping for the opposite, expecting the opposite to happen. Like they were going to have very poor health outcomes, but they ended up finding actually these benefits.
That's fascinating. I to be honest, I haven't looked into the nutrition of crickets, but I wonder what the nutrient profile is across the board.
Well, I think it'd be high protein, probably less fat than obviously.
Well, I mean, when we say protein, I mean, I guess when I talk about protein food, and I think we miss a trick. I think we need to be doing what Nina Teicholz is saying and not talking about foods as proteins or not, because whenever you have a food that's naturally high in protein, it's also naturally high in nutrients. We're talking about the micronutrients, so your vitamins and minerals. Yeah. And so basically, if you've got a piece of meat, any natural food that's high in protein is largely also going to be quite high in, it's going to be good for you. But the question is, with crickets, I don't know, and I've never looked into it, but I'd be curious to know what level of nutrients they actually have across the board. And we know, for example, that, when we were taught in medical school that a healthy adult should have 5 years of B12 stores within the liver. So you've got a large reservoir of that, and you can go for a long time on a B12 deficient diet before you'll actually become sick with the symptoms of B12 deficiency. So, whether or not you can do the cricket diet for a short period of time and then your reserves will be depleted, or whether it's sustainable.
It would be interesting, because you think about it, it is an animal. It's a whole being, and so it's going to have. I think it would certainly. I think it would.
Well, it's an insect. I wouldn't call it an animal.
Well, technically, it's a kingdom Animalia, right? So, but it's no, but it's not like a big one. But I would imagine that they would have more bioavailable nutrients than obviously any sort of plant material. But
absolutely, yeah.
And so, it would be interesting. I mean, I don't know if this is going to be complete nutrition. I wouldn't even hazard a guess, but I would guess not.
No, But it's an interesting study. Bloody interesting study.
It is, yeah. And well, that's also the thing too, is that it's always compared to what, right? They're eating a bunch of rice and low protein, low fat sort of foods, low animal source nutrition, and now you're getting the opposite. And maybe that's not as good. It's certainly not going to be as good as a steak, presumably, but at the same time, it's going to be comparatively better from where they were before.
Yeah.